staying healthy throughout the year is important, and especially during this holiday season. Joining us to talk a bit more about some good tips on that, Dr. George Salib is with us. Welcome back to the show.
Thanks for having me.
So the holiday season is great, but we're doing all kinds of things that maybe we didn't do, the other 11 months of the year. We might be out there doing things or whatever. We may be doing some work, doing some family things, whatever it might be. So give us some tips on some good eye first aid. Say we get something in our eye, we're working with fertilizer or paint thin or whatever, something gets in our eye, or maybe some dirt. We're playing with the grandkids and they throwing dirt around, you get dirt in your eye. What should you do?
Right. Well, eye injuries are much more common than we even thought. About 800,000 visits to the emergency room every year are because of an eye injury. And for some reason, men are 4 times more likely to be injured than women. And you can see here that the most important thing to think about when you have something come in your eye is that time is of the essence. You really need to get treating it right away. So if it's dirt or something like that, then you can just wash it away and rinse out your eye for a few minutes. And you can see here that there's a rinsing mechanism, and you just want to rinse it with water, tap water, anything that you can get your hands on to really rinse it out. If it's a chemical, then you have to really take a look at it from what it is. So for instance, if it's a powder, just wipe it off your face really quickly and then irrigate your eye. Just rinse it out for about half an hour. There's 2 types of chemicals that we worry about. There's either acids or bases. An acid is something like battery acid or vinegar. A base is something like lye or ammonia or bleach. The acids tend to burn the face and the eyes and cause a temporary discomfort and temporary damage to the eye, but it usually heals very well. Whereas a base tends to be more serious. It tends to penetrate into the eye more, cause more internal damage, and possibly long-term consequences. So in either case, you should really irrigate your eye, just rinse it out for about half an hour, and then think of going to the emergency room or seeing your eye doctor. The eye doctor will then take a better look at your eye, determine what else needs to be done. He'll probably check underneath your eyelids to see if anything, if any chemical is still there.
Yeah. So hydration sounds like the immediate fix, at least.
Exactly. It's very important. It's just like a stroke. Time is of the essence.
We see those stations at places that sell batteries or sell chemicals, and actually little irrigation stations like the one we showed on the slide there. Okay, so that's dirt or chemicals in our eye. What about a scratch? Something might happen and something flying around or whatever scratches your eye.
Right. A lot of the times, let's say we'll be dealing with children. They might do something and it might scratch your eye, or you might be working in the garden, for instance, and a plant swipes against your eye. If you feel, there's a couple of different things you can do. One, if you feel like a sudden gush of fluid coming out of your eye, then the scratch might have been more than a scratch. It could have actually penetrated into your eye, and then you want to protect your eye with something hard, whether it be a cup, a bowl, anything. Don't strain and go right away to your eye doctor or the emergency room to get it checked out, because in that case it might have gone all the way through. If it's just a superficial scratch, you'll feel pain, redness, tearing. Your eye will become very sensitive to light. Go to the eye doctor. He'll check it out with some fluorescein dye to make sure and see if there's anything, if there's actually a scratch there, and then give you appropriate treatment and possibly a patch so that you heal.
I know a lot of our folks like to work at the clubhouse, where we have great arts and crafts stuff at Clubhouse 5, or Clubhouse 4 rather, and a lot of our residents I know use the wood shop up there, and while they may be getting sawdust flying around, occasionally they're doing things out of metal. We've even had gentlemen build little teeny miniature engines that actually run.
Wow.
So they're grinding metal and all kinds of little pieces. Obviously, if you're dealing with metal, chips can fly up in your eye. Is that more dangerous than dirt?
Well, it tends to be, because metal can actually penetrate the eye as well. The most important takeaway point from all of this is you need to wear eye protection. And it needs to be something that covers the eye completely, from the top, the bottom, and the sides, not just a pair of glasses, because those metal pieces will fly everywhere. When you get that in your eye, it'll feel like something's in your eye, obviously. You go to the eye doctor. We can usually remove it, remove any rust that remains. You can see here that this is actually a picture of a little rust deposit in the eye from a piece of metal. And then we make sure that there's no other metal inside your eye as well. It's very important to check that and get taken care of right away.
Right. We sometimes would be maybe playing with our grandkids. I know I came home last night, my son was on the floor wrestling with his 7-year-old. And inevitably, you're going to get knocked around, you're going to get hit. You might get hit in the eye, it gets really, really red. Maybe by accident, you know, one of your grandkids just having too much fun at the holidays, too much sugar maybe during the holidays, I don't know. What about that red eye, if we got actually hit in the eye?
Right. Well, you can see that there's a picture here of a lady that was actually accidentally hit in her forehead, and that blood that tracked around her forehead tracked down around her eyes. It's not that she was actually hit in both eyes. But if you are hitting your eyes, there's a couple things you should do. First of all, don't blow your nose, because sometimes your bones around your eye could be broken, creating an opening, a passageway between your nose and the tissues around your eye. So if you blow your nose, it might actually blow up the tissues around your eye, and it would look kind of strange and take a while to heal. But definitely just protect your eye, go to the eye doctor, and what we do is we check to see if the bones are broken around your eye, to check to see if there's any nerve damage, check your vision, check to see if there's any blood around your eye. Sometimes you can get blood around the eye and the whites of the eye that looks kind of scary, but in fact it's just a little bit of, it's almost like a bruise around the eye, and it usually goes away on its own. The one thing you could do is, if you get hit, is just apply ice to it, and then don't, you know, if it's bleeding somewhere, you can apply pressure, but not right on the eye.
I guess what's the old one? If you're getting a fight, you put a piece of steak on your eye?
Right.
Seems like a waste of good steak to me, but I think I'd rather put an ice cube on there. But anyway, whatever that does.
Ice works well.
Should get it checked out. Ice, of course, will reduce the swelling as well.
That's right.
Right. What if we notice that maybe nothing traumatic has happened, but we just notice blood in our eye? Now, not to be confused with bloodshot eyes, but actual blood in your eye.
Right, right. You can see a picture of something called a hyphema, and that's where blood actually gets inside your eye. There's a couple of different causes of that. One, it could be trauma, you know, if you were hit in the eye, or it could be spontaneous if you have diabetes and you have blood vessels growing in your eye, or if you have a tumor even in your eye, that could cause that. The main thing that we worry about are rebleeds. If it bleeds once, it's okay. We need to monitor it, make sure the pressure's okay, make sure your vision's okay. But if it rebleeds, then it becomes a little more dicey. So the main thing is just keep calm. You know, when you see us, we'll probably tell you to sleep with your head elevated a little bit. Don't strain. Don't take any blood thinners like aspirin, ibuprofen, and really just kind of take it easy until it heals. And we'll need to check you every couple days to really make sure it's okay.
All right, some good tips on eye first aid and injuries that unfortunately do come our way. And again, especially at the holiday season, what a bad time to have a problem with your vision. But be careful of all those things out there, and some good follow-up with the doctor. You're still available for our clubs. I know a lot of them are planning their schedules for 2013. You're still available if they are looking for an interesting speaker. You can come and share some good eye tips with them.
Yeah, I'd be happy to.
Great,
talk about any topics.
Very good. Dr. Salib, thank you so much. Good holiday season, and a good New Year to you and your staff.
Thanks, you too.
Thanks for joining us today. We'll be continuing on with more things to talk with about your community as our program for this Monday continues.